Welcome to the Dr. Mom Show. It's Dr. D, mom of 3. Thanks again for joining us tonight. Tonight we are concluding our final part of Autism Spectrum Disorder, part 3. If you missed our 2 other videos, part 1 is the introduction to Autism Spectrum Disorder. Part 2 is about the clinical features of Autism Spectrum Disorder. And today I'll be talking about screening / surveillance and diagnosis of Autism Spectrum Disorder. Again, don't forget to subscribe to the Dr. Mom Show and share our videos. And thanks again for joining us. So just to reiterate again what Autism Spectrum Disorder is, it's a neurodevelopmental disorder that incorporates 2 big deficits, which includes 1, social skills and communication, and 2, just repetitive actions and behaviors. As far as screening for autism itself, again, just to let you know, screening is just a formal tool that's used for evaluation. Normally it's done by your child's primary care physician, so this can be a family doctor or a pediatrician. And the screening tool is not diagnostic by any means. What the screening tool is used for is to pick out those high-risk patients who we would need to refer to specialists or do follow-up screenings. Now, as far as your doctor's visits or your children's doctor's visits, developmental screening should be done every few months as they get older. Normally it's done around 9 months, 18 months, 24, and 30 months. And this looks at your child's communication skills, their fine motor skills, gross motor skills, so walking, using a fork, sitting up, things like that, just as they're progressing, just so your physician or your child's physician can see how they're growing. One of the most popular ones that are used is called Ages and Stages. Sometime your pediatrician may give it to you beforehand to fill out before the visit that it's required, or they may just ask you at the visit the questions that they want. Another popular one is the Bright Futures questionnaire. As far as autism screening itself, this is normally recommended at 18 months and 24 months. There are some common tools that are used. One common one is called the MCHAT Revised, and that stands for Modified Checklist for Autism. And then another one, it's called ESTAT, and there's another one that's called STAT. And again, these are all just some common screening tools that physicians use for your child. Very importantly, just to use my own personal experience, as a pediatrician, I do rely on the parents, because I know other physicians out there know kids just don't waltz in and start talking to you. You know, if they're seeing you every few months, there are some kids that will come in and start chatting it up with you, but then some other kids are just shy around strangers. So we really do rely on parents to be honest. So again, when your child's physician is asking about their walking, crawling, speech, social interaction, try to be as honest as possible. And also, if you have any concerns, please voice that to your child's pediatrician. Some things that are common questions on these autism screening tools include how your child's eye contact is, if they have a responsive smile, if you smile with them, if you imitate them. So for example, when you clean, does your child imitate cleaning? Or if you're driving, does your child imitate you driving? Sensitivity to some noises, and other questions too. Before we go on, let's take a little break and check out the Tripsies.
What'd you say?
A lot of times, even before the screening starts for autism at 18 months, some parents may present with some concerns of their own. Just to give you a little idea, some red flags include if your child isn't responding to their name by 12 months. Again, if there's a lack of eye contact, or what we call a social smile, them responsively smiling back to you after you smile with them. If there's any speech delays or social delays, if you feel that your child is always walking on their tiptoes, or what we call toe walking. Also, one huge red flag is if you feel that there's any regression or any loss of skills with your child. So for example, if your child was saying 10 to 15 words and now all of a sudden they're only saying 1 to 2, or if your child was able to use a utensil such as a fork and then all of a sudden now they're not coordinated enough to do that, that's something that you really do need to bring up with your child's physician. Now, after this screening process is done, and let's say there is a talk that, hey, your child did score a little higher and there may be a concern for your child being on the autism spectrum disorder, again, because the screening is not diagnostic. What usually happens after that is you will get some educational material. It's best if it comes from your pediatrician, just because this is reliable, research-based, evidence-based materials. And then your child will be referred to a specialist. Usually this is an autism specialist, also known as a behavioral pediatrician. These are pediatricians who, after their initial training as pediatricians, do an additional 3 years of training in order to learn more about patients with autism and who are on the autistic spectrum disorder and those other disease processes. You may also be sent for genetic testing for your child, because as I mentioned in the first video, there is school of thought that genes do play a role with diseases on the autism spectrum disorder. In addition, your child will probably get sent for a hearing test and a lead screening. Now, these referrals are made once this is done. What's nice about the developmental pediatrician, or when you go to the specialist, is normally included in that are therapies, so physical therapy, occupational therapy, speech therapy, and these visits are long and very just intense and specific. And what they really do is they take a look and monitor and just watch how these children interact with their parents, other people who are in the room, toys that are in the room. Again, like I talked about in part 2, clinical features include that when these kids find interesting items, they don't bring it back to their parents. They'll just sit there and play with it on their own. So those are the things that are monitored during these visits. Again, they're longer visits, but they're very, very specific and detailed. Once this diagnosis is confirmed by the specialist, again, kids will continue therapy and they will continue to see the behavioral pediatrician or the specialist. And this also helps with resources in the community that you, the family, and your child can get, and also resources of possibility of help at home and any help that your family will need. Again, just to reiterate, like I have been saying, there's still so much that needs to be learned about autism spectrum disorder. Everything is still in the works, but I am so glad to be able to share with you what is currently being done and what is known, which isn't that much. Again, please, I just ask that you always take your kids for their checkups. Be very honest and don't be shy to ask your pediatrician or family medicine doctor questions about your child or their development or any of these screening tools that are being used. And again, this doesn't take the place of your physician's recommendation or what they do, but I just want to give you some medical information so you can have a discussion with your physician. If you have any questions, don't forget to comment, and also don't forget to subscribe and give any topics that you would like us to talk about. And don't forget, of course, to wash your hands, kiss your kids, love your family, and say your prayers. Bye-bye.